It seems like maybe the flood of people has slowed down a little bit. So Summer, you can go ahead and take it away whenever you're ready.
Hey, good morning, everyone. I'm Summer Worst. I'm the Operations and Infrastructure Manager here in Office of Infectious Disease at Department of Health. We're going over today the RFA pre-application webinar for our syndemic application that got posted last week. We'll go around. Let's do introductions real quick. Emily, do you want to introduce yourself to the group?
Sure. Hi, everybody. Thanks for joining us today. I'm Emily Curio here in the Office of Infectious Disease at DOH, and I'm the section manager for a part of our office that works on integrated infectious disease testing, hepatitis C services, and our programs related to the health of people who use drugs. So that includes our work with the syringe service programs around the state and the statewide overdose education and naloxone distribution program.
Great, thanks, Emily. Claire, would you mind introducing yourself?
All right, thanks, Summer. My name is Claire Mocha, she, her pronouns. I work at DOH as the program evaluation and project management specialist. It's a new role, so I'm still tripping over the words a little bit. And I'm mostly behind the scenes, but I've been supporting with some project management around the RFA release.
A lot of project management. Claire has been a key element in helping us be successful in this release. And I do apologize, our office director is not feeling well today, so you're going to be hearing from me a lot. Beth had a couple sections she was supposed to be covering that I'm going to be covering instead. And then I also have my section, so do apologize. You will be hearing from me a lot this morning on this webinar. First, we're just starting with a little housekeeping and welcome. So we introduced ourselves and look forward. Thank you for everyone for putting their names and organizations in the chat. Appreciate that. Reminder that we're here for the syndemic RFA today. Yesterday, we had the Ryan White webinar for the Ryan White RFA. And both of these yesterday's and today's are being recorded and will be posted to our website. Let's see. You do need to apply for the application separately. There's a Ryan White application package, and then there's Syndemic, which has multiple application packages, which we'll walk through today. And then also, because of the competitiveness of the RFA, we cannot answer questions relating to the competition necessarily in this meeting. We'll gather them, respond to you with a response, and get them posted so everyone has the same question and answer for fairness. We'll get them posted to our websites. Do ask questions though, put them in the chat. Feel free to take yourself off mute to ask a question. We have folks monitoring questions and the chat and through camera. So there might be some clarifying questions we can answer in the meeting. So feel free to ask at any point. Let's see. Questions, we're gathering those through our RFA inboxes. So if you do have any formal questions after this webinar, feel free to send those through our RFA inboxes, and we'll walk through all those links here in a second. And then what we're doing is we're gathering those. We'll get a response right back to the folks who asked those questions in the inbox. And then every Friday through the question and answer period, we'll get those questions posted and the answers posted to our website. So you'll want to make sure to keep checking the website quite often, as you'll see a lot of question and answer and good information out there besides all the application material. I think that is it for the housekeeping stuff. Claire, I think I got everything. Okay. So I'm going to turn off my camera just for a second here because I'm going to share my screen. So we're going to talk next about the actual web page, key materials, and key due dates for the syndemic RFA. So what you're looking at right now is the homepage for both of our requests for applications. So keep that in mind when you're using this website. Is there's two sections. When you first open it, you'll see key overview information on how we released our RFA on the 4th, and this is for activities beginning January 1st, 2024. Right here, you'll have the Ryan White application and materials, summary application, due dates. And then if you go a little further down, that's where you get to our syndemic approach. And that's what we'll be talking about today. So key dates here, make sure to notice that the applications are due no later than 5 p.m. on June 5th. Our initial anticipated contract timeline is January 1st, 2024. All applications will be submitted through our ID RFA Syndemic inbox. That's the same inbox that you can ask questions to. So this is a great link and resource for you all to keep. Today we're going through our webinar that you're all on, and then questions we can ask. You all can ask us questions through April 12th. April 18th. You can ask questions through April 18th, and then we'll post those again, like I stated earlier, on our intranet site, as well as responding to the questions. This just goes through the questions, but you see both the applications and questions all get submitted to the same inbox. Summary of what the application is, and then we start getting into these drop downs where you'll really find some of the key and important information for your application. So first we come across the eligible program activities. This is an overview of the service categories that will we have available for applications. So this is a little different than the Ryan White for anyone who was on that webinar yesterday. This application does have a multiple application process for every service category that you are applying for. So again, here's our overview, eligible program overview. And then you can see if we go into this applications material, here's our RFA, the overview, what we expect, all the background information, the budget template, and then you see there's an application for each of the service categories you're applying for. So depending on which service category you're applying for, or multiple service categories, you could have one application, you could have 2 applications, you could have 8 applications, depending on the service categories your agency is applying for. Any questions on that part? Just because it's a little different, like I said, than the Ryan White that we talked about yesterday for those who were on it. So again, under application materials, the main RFA document. Claire, would you mind answering that question about the forms? Thank you. Do you want?
I can do that verbally. I was just going to do it in the chat. Yeah, actually, Emily in her section is going to open one of the application forms and show it to you.
Perfect.
So you'll get to see what's similar and what's different about them. So we will clarify that later.
We'll get in that here in a bit. So that's the application materials. Again, the main RFA, the blank budget template, and then the different applications, and then contract terms and examples of a statement of work here. The how to apply gives you a high level checklist. There is a checklist in each of the applications too, but this gives you kind of a high level checklist and detailed information of what is needed to apply. I think, let me go to my checklist here. We went through the main web page, key dates, June 5th, 5 p.m. Questions, that's for applications due, June 5th, 5 p.m. Applications due. Again, we can receive questions through April 18th. This application has multiple application packets that Emily will go through shortly. And I believe that's it for this section. So Emily, I'm going to turn it over to you to actually dig into the RFA and the documents a little bit more.
All right, thank you. I'm gonna similarly turn off my camera here because I'm gonna share my screen. So bear with me while I do technology. All right, hopefully you all can see the RFA. So I'm just gonna walk through.
Can you make it bigger, Emily?
Can I make it bigger? Is that better?
Yes, thank you.
Okay. Always a question. Can I use technology? We never know. So I'm gonna just walk through the timeline again. I know Summer just sort of went over it, but that we released the RFA on the 4th of April. Today we're on the pre-application information webinar. Any questions that you have, we'll be taking those until the 18th at 5 p.m. Pacific. And then as Summer mentioned, every Friday we're trying to post responses, but our sort of last response will be that April 28th. So that'll be sort of the conclusion of that Q&A. Zoom in more. All right, let's see. Is that better? Hopefully that's better. Okay, let me know if
I said
okay,
yes,
great.
Emily. Yep,
Great.
perfect.
The complaint suggestion deadline, Claire or Summer, can you remind me what that is? I mean, people can complain anytime, really, but what is that specific deadline? I can't remember.
Summer, you probably have more context on what this means, but there's a formal
Oh,
complaint
sorry.
process.
Yep.
Oh, go ahead. Yeah, you should take this one because it's your area.
Perfect. Yeah, exactly. There's a formal complaint and suggestion period. So if something's not feeling right, unfair, you can go ahead and get us those answer or questions into our inbox, and we'll address that complaint or suggestion, maybe a change, maybe you have a suggestion to how we should change the RFA or some language in it or something like that. We have until May 26th to do that.
Thanks.
And the process on how to do that is outlined in the RFA. So there's a section on how you would do that.
Perfect. Thank you. And then applications themselves are due June 5th at 5 p.m. Pacific. We'll have an evaluation period. This is approximate, but when applications will be reviewed, and then we'll announce the apparently successful applicants July 3rd. If anyone would like a debrief after the process is completed, that has to be requested within 3 days of the announcement of the apparently successful applicants. And there's a section in the RFA that covers that. So that is the kind of timeline. I'm going to take you on a journey through the document. So if you get nauseous easily, you might want to avert your eyes for a moment while I go to page 7, because sometimes scrolling can make people feel a little queasy. So let me scroll down. So I'm going to page 7 if you're following along, and this is just the section describing the funding. So it's anticipated that initial contract period will be for 18 months, with outgoing contracts anticipated to be 1 year. All budgets should be written to a 12-month annual budget period, and then we'll work with successful bidder or applicants to prorate the initial contracts based on a 12-month budget. So because the state fiscal year is a July to June fiscal year, but this RFA is anticipating funding programs starting January 1st. That's why we'll be looking at 18-month contracts, but we're asking you to submit a budget that's aligned with a 12-month period, and then we'll adjust accordingly. Summer, did I want to make sure with operations I covered that?
Beautiful, beautiful. Yep.
Okay.
Instead of just doing a initial 6-month contract to align us with the state fiscal year, like Emily said, we're doing initial 18-month contracts, and then outgoing years we'll go back to our annual 1-year contracts. We will walk through that more on the budget template too. But beautiful, Emily. Thank you.
Thank you. All right, scrolling down again to page 9. So the service categories are described, each one individually. They each have their own section and some specific, some have, there's some shared requirements and some specific requirements in each service category. So I won't read them individually, but just want to make sure folks take a look at these, read the entire RFA carefully. If you're considering applying for more than one category, that's welcome. Just make sure you read sort of the similarities and differences among them in terms of what's due. Some have some specific checklists associated with them. I'll go through kind of some documents that outline each one individually, so you can sort of see how that relates to this larger document. The focus of this RFA is really trying to integrate services across where it makes sense across HIV, hepatitis, sexually transmitted infections, and then our programs that support the health of people who use drugs, and trying to think about how to do some of this work in a more integrated fashion. So I'm going to scroll down quite a bit in this document. So just bear with me again if it's hard to look at scrolling over your eyes for a sec, but I'm going to go down to page 23. And walk through some general requirements. So these apply to all the service categories. And please make sure you review these before starting your applications, and double check that you've addressed them before you submit your applications. So that's things like making sure your services and any materials you distribute are accessible. So that could include providing translation services or interpretation services, making sure services are hearing and vision accessible. These are just some examples. There might be other types of accessibility that program participants might need, but we want to make sure services and materials are accessible to a variety of folks who may access services that are funded through the resources our office distributes. Condom distribution is a requirement. We do provide condoms free of charge for distribution, so we will expect programs doing providing services to implement condom distribution as part of what they do. And to offer, have condoms on offer for everyone. Those will be free. We want to make sure if there's any promotion and distribution, that there's some guidance folks can look to from CDC. So that is, and this actually should say STI status as well, but I think we always catch those things after the fact. And then, we really want to encourage partnerships. We really expect partners that are in the same region to work with each other. If we're funding multiple partners in a same region, we really want to encourage partnership and encourage development of a memorandum of understanding or agreements where they may not exist, and we can provide support around that. Some service categories have specific MOU requirements, so you'll want to see the information in the scope of work checklists in Exhibit J for details around that. But, the idea being, and I acknowledge an RFA process sort of inherently creates a feeling potentially of competition, but where there's programs funded in a same region, we want to make sure there's really partnership, collaboration. We're avoiding duplication of services and building on the strengths of different organizations to provide holistic services in their community. Our goal is really to have regional regional foci, and make sure various regions of the state are covered. So we want to look at, we'll be looking at geographic distribution of programs, of applicants that are funded as well. And our review panel members will be instructed to recommend a mix of applicants that can provide the best quality and range across the state. So that's just something to be aware of.
Emily?
Yes.
This summer,
Yeah.
can I stop you for a second? There's two
Absolutely.
questions. One, I think I'm wondering if maybe you can answer quickly, and then the other, I think we'll probably have to answer after the webinar.
Yes.
But the first question is, will DOH provide the condoms, or should they be budgeted for?
So we will provide condoms. Many of you might be familiar with sort of our condom distribution work as it currently stands. So that it will be very similar, and we will provide condoms free of charge to partners.
Great, I'll document that in
yeah.
the chat too.
Yeah.
The other question is a little bigger, and I'm thinking we might need to follow up off after the webinar. Do we need to have these MOUs or partnerships before we apply, and how do we know who else is applying?
So there are some service categories where MOUs or agreements are described specifically. So I would suggest really reading carefully the service categories for which you are interested in applying and looking at that, because there are some places where MOUs are specifically described, the type of MOU for what partnerships, and there's some language that sort of describes the requirements around that.
Perfect. And then we'll follow up offline after we come up with a plan on how do we know who else is applying?
Yeah.
Okay, back to you, Emily. Thank you.
All right. So just to kind of finish up this section on some of the general requirements, we really want to have a workforce that's reflective of the folks served by the programs that are funded wherever possible. And so really wanting to see applicants engaged with individuals with lived and living experience in all aspects of the organization. We also want to make sure caseloads are reasonable and adequate so that folks can actually perform their duties and activities and meet the needs of their clients. So you'll see there may be some specific language around this in different service categories, but something sort of a general requirement that we're also kind of looking to. And then there will be some required training and reporting requirements. We really want to make sure those are reasonable and relevant. So this won't be hopefully something that feels overly burdensome, but we may have some trainings that are required or some meetings that are required for any funded applicants. And then there may be occasions where we will be doing site visits, and obviously with any funding, there's some reporting required, and that's different by service category, but certainly something we'll make very clear, and where possible, to set these things up really collaboratively. There may be some trainings that we have to require, and others where we can have a discussion about what kind of training would be most helpful to your programs or staff. So just wanted to go through that. I'm not going to go through the unallowable activities and costs, but just note you should really take a look at those as you're developing your budgets, and make sure those don't include any of the unallowable costs, and that activities are all appropriate to, what is government funding. So I'm going to scroll down again on page 26 here. Just to reiterate the question and answer period, we will be taking questions until April 18th at 5 p.m. We'll be posting those written answers on the RFA website on the 14th, the 21st, and the 28th. And, outside of these sort of simple kind of questions that are already outlined in the RFA, our answers will be entirely in writing. As Summer mentioned, that's really for fairness and equity so that all potential applicants have the opportunity to see the same questions and answers, at relatively the same time. If we answered questions verbally on this call today, and someone wasn't able to join today, they wouldn't have the same benefit of time in terms of getting the responses. And also to make sure when it's in writing, then it's there for posterity and people can reference back to the answers. And we'll be responding to your questions directly as well as posting them on the website. So just as Summer mentioned, make sure you check that website regularly. And then the last thing in this packet, I'm going to scroll down again on page 30. Just looking at the sorry. So we've listed all the application content. So you'll see all the elements of the application. Not every element is scored, but we have provided information on the things that are scored and how they will be scored. So you'll want to look at sort of the available points in each section and how kind of program enhancements also might add to scores. But all the content is here. And it goes through in the kind of this section 4, each element, is it required, is it scored, and some additional information about it. So you'll want to pay close attention to all of this. And these are sort of common elements that are in every application. So regardless of service category in the Syndemic RFA, these are sort of generic elements that are in each one. So I'm just going to scroll down to page 39. All right, so this is just really around the review process, and just noting that points are an important part of the review process, but they're not the only part of selecting the successful applicants. And so again, we'll be advising our review panel to look at a funding mix, making sure we have the best regional coverage possible, that we're really providing services to the most relevant communities. And so there may be instances where we don't necessarily award a contract to the applicant with the highest score because we're looking at other factors. But certainly scoring well is is important. We want to make sure applications are responsive to what's requested in the RFA. We'll also be advising our reviewers to focus on the completeness and the content of the applications, but not focus on things like grammar, spelling, or punctuation. So this isn't a contest for the best grammar. We recognize that there's different skills and abilities around writing and writing in English. So recognizing that this isn't, if punctuation isn't used in the strunk and white, dictated way. That shouldn't be something that affects someone's score or how their application is reviewed. And our intent is not to privilege applicants with the resources to hire professional grant writers or who have staff with advanced formal education, but really to fund the best possible programs in communities. So just want to make that clear. That said, writing clearly, help making sure reviewers can understand what's being proposed is important. If reviewers don't understand what's proposed, they'll have a hard time reviewing applications. So, I think just sort of that caveat. All right, and then a couple more things in this packet to just point out. On page 40, there's a list of exhibits. So some of these are really important and are referenced in the RFA. This includes some definitions of terms. So we want to make sure, we're using the term syndemic. If folks don't know what that term means, that is defined in that Exhibit B. There are other terms throughout the document that we've used that are defined there. So hopefully that helps ensure clarity. We have some high-level information about the current state of the syndemic in Washington. And again, the syndemic is HIV, STIs, and hepatitis. There's some specific exhibits related to service categories. So for integrated testing, there's a testing checklist. For certain service programs, there's a list of safer injection supplies. And then there's some other forms and exhibits that are relevant across the service categories. So make sure you take a look at those as well and review those elements. And then the last thing in this is just the syndemic data. This is, again, some high-level data on the syndemic conditions in Washington. And you can make your application stronger potentially by referencing this data, or if you have other local data that you think would be relevant to include, that's certainly welcome. But we've tried to describe both kind of what a syndemic approach means and how our data is sort of illustrating the syndemic conditions in Washington. So that is there for your reference. Claire, anything I should be responding to right now? Or should I move on to this example of a service category packet?
Looks like you can move on. Summer is responding to questions in the chat, either by answering things that are just clarifying or by saying that we'll have to get back to folks when we have some more of an answer. But there's one more question that just popped up. I think it's relating to the service categories. So I would say, well, I'm going to let you answer that, Emily.
Okay, let me see. Sorry, which
it's
asked,
perfect. Thank you, Claire.
Is this RFA also concerned with congenital syphilis?
So I will
let us know if you
need to
think more, Emily.
So,
we can answer after the webinar.
It is concerned, yes. So it is concerned with anything that would broadly help address syphilis in the relevant service categories. And that would include congenital syphilis. Some of the activities that are specific to addressing congenital syphilis fall outside of this RFA. They're part of what's called foundational public health services. So those are activities conducted by governmental public health that are things like surveillance and disease intervention services. That's not included in this RFA. But if there are potential areas where you see relevance around congenital syphilis prevention and response within the service categories in the RFA, I would say that is definitely part of the umbrella of this syndemic and, should be something you consider including. All right, I'm gonna move on to the application packet, and this is just one of the examples. So for each service category, there's a separate application packet. This mirrors what is in the full RFA. So it's the same language and requirements, but this is just a way to hopefully simplify things for folks as you apply, so that you have a packet for each service category, and kind of all the specific requirements for the application for that category are contained in this packet. So we would highly recommend you read the full RFA first, maybe even read it twice. And then once you've sort of determined which service category or categories your agency is applying for, then you can sort of move to this specific packet for that service category. And again, all these specific application packets are on the webpage that Claire provided at the beginning of the call, and will, I'm sure, provide again before we conclude. So on this first page, which is sort of a cover sheet, you'll add your organization's name at the top. So you'll see this place where it says insert organization name. You just leave the instructions here. So just put your name, leave all the kind of background content we've pre-populated. We don't want you to delete any of that. Just insert your organization name on page 1. Page 2 is a checklist. This is optional, but we think it will help you make sure you've completed all the required elements for the service category. And you'll want to really pay attention to some of these items that have required attachments, like an organizational chart or a budget. So you'll want to make sure you're including those when you send your application in. And so you'll do this if you're applying for multiple service categories, you'll do this for each category. So again, you don't actually have to check those boxes, but our recommendation to you is that it would be, hopefully this is a helpful tool to make sure you've completed all the required elements. And so you may want to consider kind of checking these off as you go. So when you do your submission, you really can visually see that you've covered each element. On page 3, this example is the integrated infectious disease testing and linkage to services category. So you'll see the specific requirements, an overview, some core activities, outcomes, and requirements. And then some of the required activities and data. And then we outline priority populations for the category, as well as optional enhancements. So for this one, an applicant could earn up to 2 extra points by demonstrating a plan to provide services in Spanish to monolingual clients by Spanish-speaking testing staff. These will look different in each category where they exist. And then we have some additional requirements and considerations, and these are relevant for all service categories. These are redundant of what's in the main RFA document, so these shouldn't look new. And then going to page 15 on this document. This is the cover sheet. You'll just start filling the form out. Again, do not remove, I don't even know if you can, but don't remove sort of the background pieces. Just fill out the places where you can fill it out, the name of your organization, address and phone number, etc. And this continues on. There are some qualitative questions, some quantitative questions, and there's an e-signature format you'll need to follow, and it needs to be signed and dated by a person legally authorized to bind your organization to a contract. So that might be, for an LHJ, that might be your administrator. For a community-based organization, that's probably your executive director. So making sure whoever signs this is legally authorized to bind you to a contract. So for example, if I was applying for this through DOH, which we would not apply for our own RFA, but let's say we did, I would not be able to sign this because I cannot legally obligate DOH to a contract. So there are, and we'll want you to follow the e-signature format. So print, whoever that person is will print their name and then use this e-signature format to kind of e-sign the document and date it. I'm going to move to page 23 on this attachment. There's a lot of sort of boilerplate things. This is the part of the packet that really gets into the narrative. Please pay attention to page counts. The page counts are inclusive of the questions on the page. So just type your answers after the question. Don't delete the questions. Leave everything as we've put it as is. And just right after that, we've considered page counts inclusive of this, the kind of typing that's already been done in these documents. And make your answers concise as possible, while still sort of telling the story you need to tell, describing what you need to describe. And when you are ready to submit, save your document using the document naming conventions, which are on the website. And you'll email a packet with all the attachments. So it's one email per application. So if your organization's applying for 3 service categories, you're going to send us 3 separate emails with your application packet and any other required attachments. So just keep that in mind. Let's say you're applying for testing, you're applying for syndemic navigation, and you're applying for certain service programs. We would expect to receive 3 separate emails from you with 3 application packets. I think that was everything I was supposed to cover. Claire or Summer, anything I missed?
I think maybe just one thing that we didn't really write up in the agenda, but that the majority of the application packets are the same across service categories, but there's one section of questions that are specific to each service category. So just pay attention to those, because some of the organizational background, for example, you might just want to copy and paste across multiple packets, but there is a section that's very, very specific to the requirements and activities of the service category. So that's why we're asking for them to all be submitted separately. That's all I would say.
Thanks, Claire. Yeah, I'll also add, the reviewers may review something. We may have reviewers that are only reviewing testing applications, right? And reviewers that are only reviewing innovative projects or something. So we want to have a full packet for those reviewers, because they may not see, let's say you're applying for all 8 and you're like, really, you want me to attach my org chart 8 times? We do. And that's partly because you may have if you have a large organization, you might actually show us a different part of your org chart depending on what you're applying for. But you also, our reviewers will need a kind of a full packet. They may not have sunshine on the other things you're applying for. So they need to see the full picture. And I do see a question about the reviewers. There will be some reviewers who are OID staff, but we will also have external reviewers. And we will be very careful to make sure that reviewers do not have any conflicts of interest. So they can't be anyone who's worked in any of the applicants' agencies in the last, I think it's 2 years, or been on the board or volunteered or been clients of those programs in the last 2 years. There's certain, things we make sure there's no conflicts, but there will be external reviewers. There will likely be some internal reviewers as well. So it will be a mix. All right. Thanks, Claire. I'm going to stop sharing my screen.
Sorry, I'm just finishing up this question real quick in the chat. And ensuring. Okay. We are going to hop into a little more information about the budget template and the budget that is due. I did forget one thing, though, when I was doing the presentation over the website. Is on the same website at the bottom of this page, you'll find the links to our webinars, our important contact information, so both both email addresses, and then previously posted webinars. So anything these that will be recorded and previous webinars are all also on this website. Okay, so let's chat a little about the budget template. So, oops, sorry about that. So again, under the syndemic approach to infectious disease, there is application materials, and you're going to click on this blank budget template. The budget template is required for every application. So even if you're applying for multiple service categories, separate applications, you need a separate budget template for each of those. So you can't roll it up for all of your applications. There's a budget overview tab that auto-populates based on the information that you're completing on the activity tabs. So the main budget template would be the service category you're applying for, and then each individual tab might be the activity under that service category you're applying for. So you would fill out your activity title, you complete staff names, number of FTE, and then these dollar amounts self-populate. You put in a percentage, a fringe rate percentage for your agency, and the benefit auto-populates. You would give us equipment, supplies, travel, other costs such as telephone, office rental, postage, and then this all auto-populates at the bottom based off of what you've input above, and then also your indirect rate. We would need a copy of it if we don't have it on file already with our agency. And then your proposed rate, whatever it is here, you put that in, and again, it auto-populates your indirect. So one tab for each activity, and then you'd have one budget workbook for each application. The other caveat, like we talked about a little earlier, is the initial contracts are 18-month contract periods, a year and a half. But to simplify the budget process, we're asking for a 1-year annual budget. And then once apparently successful bidders are announced, we will work with each agency to then prorate those 1-year budgets into an 18-month budget. So it was determined to do a 1-year budget. So it's a little easier for you all. So you can put 1.0 FTE versus maybe 1.5 FTE for a 18-month period. So 12-month budget. Let me look at what else I have on my notes.
Summer, there's a budget specific question here that says, if we have additional staff, can we modify the form by adding rows?
Yes. Yes. Oh, wait, hold on. I added a bunch. Hopefully you shouldn't have more than 56 staff, but if you do, let us know. So there's this little collapse field here, and you can expand to add more staff if needed. But the formulas are a little touchy. So if you need more than the, I guess it's 25 staff or something like that. If you need more than the 25 staff per activity, please reach out to that inbox, the Syndemic inbox, and we can make an adjustment to the template for you. Okay, I think that was it for the budget template. Any questions on the budget? Okay, then we're gonna do our wrap up here. So,
Summer, I did have one
Yes,
question about the
of
budget.
course.
I see in the materials, you talk about you have $6 million to start with for all of the areas, but where do we find the guidance on what each area minimum and maximum is for our budgets?
Emily, I don't believe a minimum or maximum was established for the syndemic, was it?
No, we really want to see the mix of applicants,
Oh, you're
of
killing me.
applications, and make
Okay.
sure that we're providing an appropriate regional mix of services. So we purposely did not include a minimum and maximum in each service category.
Okay, Emily. I'll do it your way. Thank you.
And then Summer, there's a couple other questions in the chat, but I'm not sure if these are ones that we'll want to kind of get back to folks on.
Oh, great. Let me look here. Okay, so what type of equity, diversity, anti-bias training did the reviewers undergo? Sure, let us reply to that. We'll get you all of that information offline after the webinar. We discussed the additional staff, so there's a little plus there to add up to like 25 staff. If you need more than that, let us know. Again, all these questions will document, questions and answers we're going to document and get posted to our website. Not found the minimum and maximum. We just talked about the minimum and maximum. Is there a limit on how many, oops, I lost my spot. Is there a limit on how many partners can be in a region? Emily, you want to answer that one now, or would you like us to
I think we
reply
can
after?
just say there's not a limit. Obviously, we would want a reasonable mix across the state. So there's, that would be part of the consideration our reviewers will be taking under advisement. But there's not a limit. We would not want to have all the services in one region, obviously. So we'll be looking at that really thoughtfully, but nothing dictated around that.
Perfect. It does look like there's $1 million allocated for prep housing.
Yeah, and that is an area, that's an exception where we do have sort of a stated ceiling
Okay, thank
in
you.
a service category. Yeah. Thank you for catching that, Karen, because that definitely is true.
Did I get them all clear? Okay, great. Thank you for the great questions. Okay, so we're just going to do our wrap up here. Reminder of key dates. Questions due for the application April 18th, and we'll continue to post those answers every Friday for the next 3 weeks. So the 14th, the 21st, and the 28th. We'll post those to our website, but keep looking on that website because any changes, any information will get posted to that website. But you have until the 18th at 5 p.m. to ask us any questions that you may have. We'll respond to them by the 28th will be our latest deadline, but we have people monitoring the inbox. You'll get a response that we've received your question. It'll get forwarded to an SME. You'll get a response directly, and then those answers, questions and answers will also get posted on our website. Complaint suggestion deadline, we went through that, May 26th, for any suggestions you might have for the RFA and how it's written. Applications are due June 5th by 5 p.m. That's a huge due date you'll want to remember. We need to have them in our inbox, date stamped by 5 p.m. on June 5th. All questions, please go through the RFA inboxes. So even though you might be used to working directly with Emily, let's say, please to ensure the competitiveness and the fairness of this competition, let's make sure we address all those questions directly to the inbox, and then we'll work with our SMEs to make sure we answer that. Okay, the last thing is what to expect. I think the last thing, but we'll go through some. If I missed anything, we'll go through that. So what to expect when you submit your application. We are still working out a process for that. So we'll have a little more information, but what to expect right now. You're going to submit your application to the same inbox we chatted about. You'll get a response from the inbox that says, your application has been received, so you know that we're in receipt of that application. So if you don't get that and you've sent an email, you're going to be wanting to reach out to us at that RFA inbox in case something didn't come through or it got stopped up because of attachment sizes or things like that. So if you don't get that receipt email, let us know. I am the RFA coordinator, so you can reach out to my phone number if you need to, and I'll put that in the chat here, or my email if you're having issues like spam issues with that inbox or something and you didn't get your receipt that your application was submitted. Then what we're going to do is we'll look at the checklist of the items that were due for your application and we'll send a response. We received your budget template, we received your application package, and you'll make sure that we've received all the attachments. So let's say you attach 4 documents and we respond and say we've only received 3. You'll want to work with us to address that before the application due date, or if it's past the due date, you'll want to work with us to show a receipt of your email. Yes, I sent 4 attachments, but you only have 3 attachments. So make sure you're paying attention to those receipts for getting the application to the inbox and then the materials that we received for the packet. And then officially after the reviews, you'll hear from us, yes, your application was submitted, it wasn't complete, or yes, your application was submitted and you're an apparently successful bidder. I think I hit all the points. Did I miss anything? Any follow-up questions?
So there's a question in the chat about the regional approach. I'm wondering if that's something we want to try to clarify here, or if that's something we need to get back to folks on to provide some more.
I would just say, I think in the application, we ask you where you'll be providing services. So we'll be looking for something that is clarified from applicants about where they plan to provide services. The partnership is really, if there's let's say 3 programs that end up getting funded by different organizations in the same region, we'll want to, but doing different things, right? Maybe one's doing testing and one's doing navigation and one's doing prep housing. We'll want to make sure all those folks are talking to each other, that they have agreements with each other, that they're sharing information as appropriate, that they're not duplicating services. In many cases, they may have the same mix of participants or clients. So where it would be appropriate to have release of information, where an MOU might make sense. So that's really what we're talking about with the regional approach. It's not that there may be programs that want to provide services in multiple counties within a region. We're not expecting every applicant to necessarily do that, but that we have a system of services that makes sense, that is responsive to the community's needs, and that that folks are talking to each other in regions, right? So we don't have a syringe service program that is not talking to the local integrated testing provider. So I hope that clarifies it. We're not expecting every applicant to provide services through an entire region. It might make sense in some instances for an applicant to only provide services in one county or in a couple cities, right? So it really depends on what you're proposing, what your population is like, how big your area is, variety of things like that. I hope that that clarifies that. But if not, please send us a question and we will respond to it in the through the process.
While you were talking, Emily, the question came up kind of, would that happen before or after the application is submitted? But I kind of lost where that question came in. Kendria, feel free to speak up and let us know.
Hi, yeah, I just had a quick question in terms of as well, we are all applying to the similar funding. And so we wouldn't necessarily know what other organizations are putting in their application. So if we don't have communication to partner before we all submit our applications, is that then something you all are going to look at and then maybe say, hey, community healthcare, you're doing some testing, but so is this other organization. Is there areas to partner after, or are you expecting that we kind of chat with each other before? I guess that's kind of like you mentioned, the nature of a competitive application is that sometimes we might be competing for the same funds. So I'm just trying to make sure we are orienting ourselves ahead of time to see if there's partnerships available, and or are you all going to tease out some of that and then maybe have funding that looks different for each of the organizations, and then we can work on MOUs after. So just more clarity around that.
So before applications are due, any discussions you all have outside of this process are entirely, up to you all. I think it, is something agencies could pursue, is talking to other agencies in their region that they think might apply and have a conversation. That's certainly something you all could do. We can't facilitate that because it's pre-application process, and that could give, there are sort of ethics rules. We can't get too involved in your processes prior to applications being submitted. But when we have gone through the review process and apparently successful applicants are chosen, our intention is to do where needed, where desired, where asked for, do a little matchmaking and make sure programs that are funded in a similar area of the state, where they might be providing complementary but different services, are well connected to each other, that you might have agreements in place where relevant. There are some places in the RFA, like I mentioned before, where we're asking for MOUs ahead of time around certain areas of service. So you'll want to be mindful of that. So there may be some need or interest or desire for some of y'all to be talking to each other now. We can't be involved in that right now. After applicants are funded, chosen, and we're starting the contract process, we can help facilitate those conversations. And part of our desire to have reviewers look at sort of what's funded kind of regionally and making sure there's good geographic distribution is also to make sure we're not funding, we may not want to fund 5 testing programs in the same community. That might not be the best mix of services, right? It will depend, I'm using that as an example, but this will just really depend. So it's a kind of a both and. Programs, agencies can certainly be talking now about partnership, about what that might look like. There are some areas where programs can apply with a subcontractor arrangement. So that's something programs might want to discuss. And then certainly once applicants have been notified that they're successful, we'll be really wanting to make sure there's collaboration, conversation across programs so that there's really a suite of services available in a community that's sort of agnostic about who's providing them, right? that individuals moving through the world can access a variety of things, hopefully fairly easily, because programs are talking to each other, doing warm handoffs, having strong conversation and collaboration. I hope that helps.
Yes, thank you so much.
I think this last question we can probably answer too. There will be it's likely that multiple awards will be granted per category.
Perfect. I put that in
And
the chat.
expected. Yeah.
Yep. I put possible, likely to have multiple service categories so that DOH can ensure the regional coverage that we've been talking about. I think we have one back up here, though, a little Emily. Let's see. We might have a couple. Would an application provide directs? Wait, I thought I saw a different one. Hold on, before that.
I think there's one from
Here we go.
Jenny that
Can
we
you
haven't
talk?
talked about.
Exactly. That's the
Yeah.
one. Yep, perfect. Can you talk more about the innovative projects approach as well as targeted populations? This is the first time DOH has included specific language about transgender populations. Is there a specific idea about what services would be sought? And Emily, feel free to say we'll answer offline, or you have a thought off the top of your head.
So we do not have, this is really intended for you all to tell us something that you would like to do that you think has strong, there's strong support for, that you think is needed in your communities, or that's maybe something you've been wanting to try that's sort of outside the box thinking. We have no preconceived notions about what those might be.
Claire, would you mind going with the next question?
Yeah, so the next question is also related to the innovative service category, but it says, would an application to provide direct services at our LHJ, including STI testing and treatment, HCV testing and treatment, naloxone distribution, etc., would this be considered community-based integrated testing or innovative or something else, like a combination of different service categories?
That sounds like a proposal where an applicant might want to apply in more than one service category.
And then someone asked, how many total agencies do you anticipate making awards to?
We have no preconceived notion about that.
I think that's all the questions I've seen so far. Does anybody else have any questions you want to put in the chat or unmute and ask?
Hi, this is Amber Casey from the Hepatitis Education Project. Our current DOH contract includes services that we provide sort of on behalf of DOH, for example, distributing test kits, providing technical assistance to new viral hepatitis testing agencies, for example. Should we include those as well in this RFP, even though they're not explicitly listed, or is that something that we'll do separately, or are you guys getting rid of that?
We'll answer this one offline.
Exactly. Yep.
Okay.
Let us get back
Thank
to you
you.
about your current contract. Yep. Perfect. Great questions. Appreciate everyone's thoughtfulness on this. And please feel free to reach out to the inbox. You have my information now. And we look forward to all the applications. We're excited to see all the innovative work. Emily or Claire, anything you want to say to wrap up?
I just want to acknowledge that these processes are stressful, and I have been on both sides of them. I think, we have tried to make this process as hopefully straightforward and clear as possible, but I think whenever you do these kinds of big application processes, it's hard to not make it overwhelming. So I guess I just want to appreciate you all for being on this call today, for the great questions, acknowledge that this is a hard season. And our intention is really to not, I don't know if we've succeeded, but our intention is not to overcomplicate things or to make things feel confusing or opaque. So please, if you have any additional questions, please use that inbox to ask them. We really want to make sure a variety of agencies have an opportunity to apply, and that we get a really interesting mix of applications that will really serve the people of Washington well, and particularly serve the communities that are experiencing, some of the greatest inequities around HIV, STIs, hepatitis, and related conditions, including things like overdose. And so that's the spirit in which we've entered this. The intentions and the execution maybe don't always align as well as we like. We do work in state government. We can't change that. But please reach out to that inbox if you have questions. We really want to make sure we're answering them and giving you clarity. Our intention is not to be confusing. So again, really grateful for you all, grateful for you entering into this process with us, and we're really excited to see what the applications look like.
Thanks all. We'll get this recorded and posted to our website here in the next probably week or so. We have to run through some state channels, of course, so we'll get it posted, but appreciate you all. Have a great one.